All right.
Yes, hi, this is Dr. Khan. So I have done an unblock resection, removal of the implant and capsule as one system from a patient who had the augmentation done in 1976, 35 years ago. So as you will see on the right side, this is where the implant was. You can come and have a look. You can see this is more oval shaped, like so here. And you can see this one is relatively irregular shaped. And I removed not only the implant capsule, plus also what is these extensions. They look like scar tissue. As you can see, this is not fat. This is hard tissue. And as you can see this is hard, scaly. And if I lift this up, you will see the entirety of the implant and capsule is being removed in the en bloc fashion. And in this case as well, 100% of the capsule has been removed along with the implant. Now what I'm going to do here is, for the first time, the right side patient's initial CL. I'm going to go ahead and cut this open, and I'm actually going to access from here. You will see none of this built into the patient's chest, and you can actually hear the calcification that's present, the silica, and relatively hard. This, the fact that she has implants from 1976, I know they're ruptured. She has had an MRI that showed rupture. And you can see, look at all of this, the color. And you can see, look at this, what is, there's an interesting attachment to it. But you will see on the back, as you can see, I can snap it. And this is like the rough scales of a fish, if you will. I'm going to snap this. This was hard and all encased, all done en bloc. None of this spilled into the chest. Everything contained, all of this. And you can see, if you look at the pickup, all hard, scaly. And this is where, you know, this has to be done. None of this spilled into the chest. No need for drain. Surgery was done very meticulously. I have the best team here at the hospital. And so the patient has had a complete definitive removal of the implant capsule. None of this spilled. And as you can see right here, if I go like this, you can see this is all a rupture. And if I go and press over here, you can see where the rupture was. So you can see the implant, basically where it was coming out. What this is, I'm not sure. I'm going to go ahead and send this off to pathology as well. Very interesting. It looks like kind of a, I've not seen this before. I don't think it's part of an implant, but it could be like kind of a band-aid type of a, it's very defined, very sharp edges, like it was like a foreign body left in. I have not seen this before. This is not part of any implant. I'm going to go ahead and leave this here. We're going to send this to pathology as well, so we can further define this. Let's see if it's here or not. So I'm going to go ahead and cut this open. By definition, any implant from the 70s, 80s is ruptured because of the older technology. And given the length of time, remember the implants, the longer they are in the body, absolutely they're ruptured. So as I go in, this is different. You can actually hear me cutting through the crystals. None of this spilled. And this is the whole beauty of doing the surgery in the fashion that I did. You can see how differently encased this is. So I see the same thing over here. So I think this was part of the capsule. This is 1976. Now this is ruptured in a very different way compared to the one on the right. So this is the one on the left. And you can see how this comes out. And none of this spilled into the chest. And the whole surgery was done in a very careful, meticulous way, such that none of this spilled into the chest. And you can see those hard calcifications. And as you will see, the irregularity, this is razor sharp, as you can see the edges. And none, look at this, this is like cottage cheese. And what I'm going to do here is, I'm going to go ahead and peel this off. And this is like, you know, cement. And I can, like it's a paste like I've shown many times before. This was all within. And you know, if you show this video to anyone, I challenge them to get augmented, because who would want this in their body? And this is precisely the reason when I saw this in my training, I said this is something that I will never do to my patients, even though financially it is very rewarding to put an implant. So as you will see right here, look at all of this. This poor lady was living with this, and certainly it was within her body and hurting her, taxing her, costing her with all these arm movements. Look at all of this. All contained. No need for drains. No need for any intervention. I removed them very tactfully, very carefully. These capsules are going to be sent to the pathologist. Now let's go ahead and look for this one small piece that's embedded in here. This is apparently what appears to be part of the implant. And you can see this is indeed not a foreign body, but this is part of the, I think what they did was, it was part of the implant, and the surgeon would use this to anchor to the wall, to the rib cage, to the soft tissue, such that the implant wouldn't move. So this is indeed a foreign body, a part of the implant from the 70s, which I have not seen before. So this is not abnormal in the sense that this is part of the system, as you can see, and I've seen this in the newer set of implants where they use this to anchor. But look at this big ball. It's like a small egg. And if I open this up, if you look at it, it's truly a cottage cheese consistency. All these chemicals within the patient's body causing her harm. And obviously look at the way this is disintegrated. All contained. None of this spilled into the chest. And this is where the surgery needs to be done in the absolute nicest manner possible, millimeter by millimeter, such that none of this spills in and the patient gets a fair chance to bounce back. This is Dr. Khan from Executive Plastic Surgery. Hopefully you found this informative. Please share. There are many patients who are living with implants that are likely ruptured and they do not know. They may be having chest pain. They may be having these rashes, amongst other issues of what is breast implant illness. Classically, breast implant illness exists in 100% of the patients. Implants are not meant to be in the body forever. As you can see, the FDA warning has put out basically the black box warning where, number one, the implants per the FDA only last in the body 10 to 15 years. I say 7 to 10 on average before they start creating the negativity. Sometimes as early as a week, that I have seen for some of my patients where I removed implants. They came and they started complaining a couple of weeks later that their body is never being the same. The second thing the FDA put out is that implants are associated with lymphoma, especially the textured, and certainly not only all the textured, but smooth ones as well. And the third one, that the implants are associated with breast implant illness. Remember, the implants are not meant to be in the body forever, and after some time you can see that they only disintegrate. We know from the many studies that the longer you have them in the body, especially after the 10-year mark, you're going to see that they're going to start breaking down, and they certainly absolutely would need to be replaced so you don't end up with a catastrophe like this. This is Dr. Khan from Executive Plastic Surgery, Novi, Michigan. Please share. Thank you.